Hello, everyone. My name is Bronte Johnston, and I am in my second year of the Health Sciences Education Master's Program, studying how point-of-care ultrasound, or POCUS, can impact midwifery under the supervision of Dr. Beth Murray Davis. In 2018, the College of Midwives of Ontario expanded the scope of practice to include POCUS to help guide clinical obstetrical care. Midwives are not required to perform these skills, but if they choose to include them within their practice, they are required to complete an educational program to provide instruction on appropriate techniques to perform and maintain POCUS competency. The Midwifery Education Program, in partnership with the Medical Radiation Sciences Program at Mohawk College, designed and implemented a POCUS continuing education course for primary maternity care providers, the first of its kind in Ontario in fall of 2019. The course content included sonographic knowledge and techniques across the 3 trimesters of pregnancy and used a variety of instructional and assessment approaches. The course required learners to complete 3 components: online modules, hands-on skills workshop, and a clinical practicum. As this was a recent scope expansion and currently there are no other existing courses focused on POCUS in primary maternity care, it was important to evaluate this project to understand the educational impact of the McMaster Mohawk POCUS for primary maternity care course. There were 2 components to this study. Surveys were used to collect data across 4 time points, such as before the course and up to 1 year of follow-up. 5 and 7-point Likert scale questions were analyzed through Fisher's Exact and Mann-Whitney-Wilcoxon tests. Open-ended questions were qualitatively analyzed using thematic analysis. Secondly, semi-structured interviews were conducted to better understand their attitudes and clinical behaviors. Interviews were coded and analyzed using a combination of Corbin and Strauss as well as Sharma's constructive approaches to grounded theory. As this is an education-based study, we've applied the Kirkpatrick model to evaluate the McMaster Mohawk POCUS course. Levels 1 and 2 refer to participants' thoughts about the training experience and acquiring new knowledge. Levels 3 and 4 focus on deeper learning with regards to how has the curriculum changed the participants' behavior? How are they using POCUS in their practice? How has it changed their midwifery services and organization of care? Results indicate there was an increase in POCUS use throughout midwifery clinical practice as they were able to acquire POCUS skills and knowledge as demonstrated in their completion of their online modules and weekend scanning sessions. Our surveys indicated that statistical significance was found between an increase in POCUS use upon course completion and that participants who had access to a device and completed their clinical practicums were continuing to use these skills. Frequent POCUS applications included fetal presentation and assessment of pregnancy viability in the first and second trimesters. Other applications, such as biophysical profiles, were not used as often because they are more appropriate for diagnostic imaging, which helps to reiterate that participants are familiar with the limitations of POCUS and when diagnostic imaging is required. Participants felt that POCUS was beneficial to aiding midwifery practice as it provided more clinical information to guide clinical decisions accurately and faster. Throughout the post-course surveys, it was apparent that participants were integrating and planning to continue using POCUS within their clinical practice, demonstrating how the midwifery field is shifting to provide more comprehensive care. In qualitative interviews, some barriers that participants experienced with POCUS were having access to clinical placements for hands-on learning and the cost of a device. But the benefits outweigh the barriers as POCUS is able to refine the role of the midwife by providing more education and comprehensive care to better serve their communities. Altogether, it is apparent that POCUS is improving midwifery clinical care and how education initiatives play a key role in helping to provide the best care for their clients. While there were barriers, POCUS is starting to be used in clinical practice and are aiding their clients in developing clinical plans and helping to reduce anxieties around pregnancies. Hopefully, POCUS education and integration will become more widely apparent in midwifery. Thank you.